Welcome to this module called Patient-Reported Outcomes, or PROs, a guide for patients. This video was prepared in partnership with the Health Outcomes Observatory, H2O project, and EHDEN, the European Health Data and Evidence Network. In this video, you will learn what outcome means in healthcare, why PROs are important and how they are gathered, why it is beneficial to share PRO data, and how safe it is to share, how personal data is managed, why and how H2O and EHDEN support gathering PROs. What does outcome mean in healthcare? It simply means how you feel or what you've experienced with your health. There are three common types of outcomes. 1. Health outcomes are planned measurements used to determine a change in health state. They include symptoms, responses to treatment, or mortality rates. They are used by doctors, governments, and healthcare systems. 2. Clinical outcomes are measurements made by trained healthcare professionals after observing a patient's condition. They include how effective or safe a treatment is, and can help establish standards to improve treatment. But they can't always show how a patient is feeling. 3. Patient-reported outcomes, PROs, are a measurement of a patient's personal view of their health and well-being, and how they manage daily life. They are particularly helpful because they can show change over time. How are PROs gathered? There are many ways PROs can be reported: questionnaires, surveys, tracking on smart devices, or in conversation with their healthcare providers. Patients are usually asked about their perception of symptoms, quality of life and well-being, the emotional and social impacts of their conditions, and more. Information only the patient can know. Why are PROs important? PROs help patients and doctors understand if a medication or device work as expected, if treatment is effective, and what matters most to the patient. They can help keep track of how a patient feels before and after treatment. They are also useful for keeping track of and monitoring health events happening between appointments. Why is it beneficial to share PROs? Are there any potential risks? PROs may be collected in routine care or research. Sharing PROs can be important for individuals. Patients who bring PRO data to their checkups may find they have better conversations with their doctors, which helps improve their care. And it can help the broader community. Patients can consent to their data being combined with others' data to create anonymous data sets. These data sets can show useful information, including common experiences on a treatment, good and bad, across larger groups, how many patients are undergoing the same treatment, which treatments give the best results. This may show patients how they compare to others. Researchers, medicines developers, and governments can look at anonymized PRO data to assess the outcome of care. This can help inform decisions on medicines, devices, care management, research, public health decisions, and others. Do H2O and EHDEN support gathering of PROs? EHDEN aims to build a European network of data partners in a federated real-world data network using standardized analytical tools to conduct research at scale across multiple sites. H2O aims to measure PROs in a consistent way, which is a process called standardization. We need standardization because currently there is no way to gather PROs across multiple populations or diseases. H2O wants to link PRO data and clinical outcomes to provide an additional, rich source of information. Standardization and linking PRO and clinical outcomes will open up new possibilities and will bring benefits for patients and the broader population. Including the patient voice in healthcare decisions in this way, how will personal data be collected? H2O is a solution for storing, collating, and sharing health data. Patients will be able to enter their PROs by using the measurement tool offered by their provider. Keeping patient data private and safe is our priority. H2O will always adhere to local data protection principles, and strict security rules govern how we collect and share data, including asking permission, removing personal information from data before it is shared, being clear on how data is used, dynamic consent, patients can decide what data is shared and change their mind, only sharing data with approved partners. To learn more about data governance and privacy, check out Module 3 in this series. Gathering and sharing PROs is complex, requiring the involvement of patients, providers, and healthcare decision-makers. However, it's crucial that we find ways of gathering these PROs more effectively so that patient needs are included in decision-making at all levels. Stay tuned for the next course.